I am the student of Masters in Healthcare Management, San Francisco College, Brooklyn. Today's presentation topic is the business impact of transition to the value-based care on independent primary care practices. First of all, I will like to add some contents and I will give some introduction. Introduction: value-based care landscape, key VBC modules, physician readiness and barriers, quadruple and foundation, financial strategy transformation, workflow and staffing red signs, consolidation pressures, clinical outcomes under VBC, quadruple aim revisited, market, social justice and economics. Is WBCs good for independent practices? And the second thing is value based care. VBC arose from federal reforms like MACRA and MIPS linking reimbursement to quality and cost savings. This shift financial responsibility to the provider and pushing independent practices to use analytics and care coordination tools. Large systems adopt more easily and while smaller ones face challenges. VBCs reshapes outpatient and primary care focusing on prevention and chronic disease management. Key base modules: shared risk structures and requirement for the independent practices. ACOs and advanced AMPS have shared risk structures, provider earn bonuses on face, penalties based on performance, and the requirements for the independent practice. These modules require accurate reporting and high performance from independent practices. MIPS assessments, MIPS assessment, clinical on quality, cost improvement, and interoperability. Financial remarks and challenges. Participation offers financial rewards, but the practice must first cover technology and management costs, making early adoption tough yet vital for the future success. Aimed changing reimbursements. Physician readiness. These are the four to five different kinds of structures. Uh, Winberg's 2020 indicate the larger integrated systems enable better VBCs participation due to administrative support and data access. Independent physicians lack this infrastructure effective engagements. Quadruple aim. The quadruple aim: improve patient experience, population health, lower cost, and clinical well-being supports with the VBC reforms. It encourages coordinate and preventive care needing structural changing in the independent practices like teamwork and the tools for the population health. Limited resources hinder full implementation, but with support, VBCs can enhance outcomes and align primary care with the health system goals. Financial and strategic transformation. These two types transition to come driven reimbursement and importance for the effective leadership. Independent practices must shift from value based revenue toward outcomes driven reimbursement. This requires substantial investment to EHR upgrade, analyst platform, and the care management programs. The second thing is that most importance of effective leadership. Effective administrative leadership is essential to avoid financial losses and the guide to the team through complex reforms. Increase in operating budgets. Informational in interviews noted operating budget risks rising nearly 20% during the transition due to hiring coordinator, data specialization, and reporting staff by staff. Risk for the poor strategic plans. Without strategic planning, practice risk financial strain and reduce opportunities. Consolidation issue. This is the, I think so, major and part of the issues, major part of the issues. WBC's VBC's complicate complexity and cost derive independently practice consolidates with ACOs, MSOs, and larger systems. Windberg's 2024 confirm larger practice are more likely to join VBCs. Threat to small practices, despite the goal for the enhancement providing primary care. Interviews, finding, and consolidation effect. While consolidation, these are the normal things. Offer ability, stability. It may reduce physician or autonomy and patient choice. Clinical outcomes of VBCs. Research shows VBCs enhance chronic disease management, preventive care, and reduce avoidable hospitalization. Respondent reported to fewer emergency visits after weekly out research. High risk patient. VBCs focus on the continuous care patient in engagement, and the monitoring leads to the better outcomes, providing it effectively achieves its goal for the improved health with the implement. Quadruple aim revisited. These are the 7 steps. Number one is the while VBC improve clinical well-being. Number two and three is the transition phases often increase burnout due to documentation. Three is the independent practice with limited staff are easily vulnerable. Number four is the interview describe early transition period as exhausting. Number five is the stress decrease once care coordinate we hired. Continuous conditions that must be prioritized to prevent clinical overloaded and ensure sustainable. One thing I missed in the 6 points is achieving the quadruple aim requires adequate staffing, workflow, red sign, market justice and economics. FFS reward productive productivity but causes overrealization. VBC's focus on the equality, efficiency, aligning with social justice principle. It reduces more moral hazard by holding providers accounting and discouraging low value services. Interviews noted noted better out research and underserved patients, showing VBC's equality goals, while FSS sports independent BBCs enhance efficiency and equality health outcomes. VBC is good for the independent. These are the different steps for the independent practices. Number one is the evidence suggests VBC's benefits. Evidence suggested that VBC can strengthen independent practices through improved outcome, patient with satisfaction, and long-term financial stability. Number two is the challenges without support. However, without subsidies, technical assistance, and simplified reporting, VBC's risk accelerating consolidation and geoparagliding practices autonomy. Number three is the need for the targeted policy. Independent practices need targeted policy support to complete fairly with VBCs. Potential Potentially with the investment benefits with the investment. With adequate investment and adequate investment and clear guidance, VBCs can empower independent primary care rather than marginalize it, ultimately enhancing care quality and sustainability. These are the references which I used. Thank you so much. If you guys have any kind of question, please do let me know in the comments. Have a good day.